Webb. I'm the Veteran Liaison for the state of Michigan. I'm the project lead for Walking with Warriors. We began this program in 2016, and we've progressed. It came out of a meeting that we had with in Ann Arbor with the state of Texas. Looked at a model they had that was mostly wrapped around peer support, and kind of developed and adapted into what we needed here in Michigan. Our veteran navigators encompass 10 different regions. They're called a prepaid inpatient health plan, a PIHP, and there's one for each one of those administrative levels, and then there's also 9 navigators that cover about 15 counties in the state of Michigan. So we've got 19 navigators.
As a navigator, I'm responsible for Livingston County, Washtenaw County, Monroe County, and Lenawee County, which gives me roughly 42,000 veterans in that geographic space that have probably some need of some kind, and a lot of them are already connected to the VA. That's the biggest resource that I run into needing use for. But as a social worker, I'm naturally inclined to pay attention, and we're designed to pay attention to mental health.
The navigators, the majority of navigators are all men and women that have served in our nation, be it active or in the Guard, Reserve, or active duty at one component. Myself and another navigator, we are the only ones that are not veterans, but we are the sons and daughters of former military. So that's pretty much the composite, and pretty much all the navigators have a heart to want to help veterans.
There are also 2 female veteran coordinators that provide support for our female veterans with a plethora of events and virtual meetings, virtual peer support, and then we also have some peer supports inside of our community mental health that support our veterans as they get connected to services there.
Now, organizations that support military women are great. There's so few of them out there, and it's even better when fellow military veterans are the faces behind the efforts. Now, Women Veterans Strong is primarily run by 2 facilitators, each dedicating a portion of their lives and talents to the success of the members. Myself, Shelley Rude, I'm based out of Detroit at Selfridge Air National Guard Base, where the program headquarters is also located. And my partner in crime, Amy Batch-Elder, she is based out of Grand Rapids. Now, looking ahead to the new year, we are laying the groundwork so that in 2021, the uniqueness of our program continues to shine. We're onboarding a people experience platform. This is aimed at increasing the mental resiliency of our members and keeping them engaged through custom messaging and videos. We are very excited about what we've accomplished over this past year, and we're very much looking forward to what is to come in 2021.
Yeah, so the veteran navigators, I mean, their primary responsibility is to reach out and to engage with veterans and their families and ensure that they're connected to the resources that they've earned, to the benefits that they've earned.
Well, the important part about the Navigator, our first mission is to get veterans connected to mental health services, get them inpatient, outpatient services, physical health services, anything really that's affecting their quality of life. You know, it might be something with their income, it could be housing, you know, just a vast array. It could be legal. I've done a lot of legal issues with veterans. Just helping them navigate through a lot of the barriers and challenges that they need to go through to accomplish anything sometimes. You know, everything you do, if you're trying to get some benefits or get something done, there's some hoops that you have to go through. So the big part, I think, is helping the veteran get through those barriers, because it just makes life easier for them. You know, there's a lot of stress when you're trying to get help.
We help lead and guide that man or woman to whatever resources that they pretty much earn once they swore that oath. Our role as navigators is to make sure everybody gets connected to some benefit, be it in the community or via the VA. So however we can help those men and women who helped us is the mindset of navigators.
So some veterans might already be connected to, say, the VA, but maybe they need some connection to mental health services or to housing services or legal services. Walking with Warriors has a navigator in their area that knows those resources on a personal level. So the navigator is able to maybe break down some barriers and provide smooth entries into resources for veterans who are already struggling with something that is a little abnormal or out of the day-to-day kind of condition.
This event here started, we did our first one in Wayne County in Detroit. Then we said, hey, let's do one in Oakland County. And then we said, well, let's bring this out here to Macomb County. So what is it? Care package event. So what we wanted to do was definitely, in light of COVID, we still knew that folks would be in need, and we wanted to be more of a resource to folks because we knew it would be more needs now because of COVID and things like that. So we decided to come up with these drive-through care package events.
And getting out here and just kind of, you get a little bit of interaction. Yeah. You know, even if you're just driving through, at least you're talking with somebody. These guys might be sitting for a week not talking to anybody. And this might be the one interaction they had all week, just coming out here. So we have a lot of these kind of events, usually when things are normal, and that's where we get a chance to meet up with a lot of veterans and help them in other areas that they didn't realize maybe they needed help in.
Two other areas that we have a brand new pilot with a recreational therapy program with Kyle Hine out of Heroes Haven.
My Heroes Haven is a place for our vets and first responders to come and to feel welcome, whole, and initially help with any symptoms that they may have in relation to post-traumatic stress or suicidal ideation. So while we have a space here where we have ongoing programs, we also have a new program called the Get Back Up program, where we take this demographic through a 3-day retreat-style program and really dive into the issues that are causing the PTS and suicide ideation. So why we have this time and this space that we get to spend with them and the ability to really relate and build those relationships, which is very effective. After those 3 days, we don't just send them home. While we're bringing them home and helping with their healing process, here at Heroes Haven, we have ongoing programming that'll help with their return home, if you will, to normal society.
So the new program they have here at Hero Haven is going to be an opportunity for us to give veterans a little bit of that peer support. So they'll come to the program here, kind of form a sense of community with other veterans, and then they'll have long-term support. So if they come into our system and they're seeking help for behavioral health or substance use, this is just one more tool that we can use to help set our veterans up for long-term success.
What I hope to see for the Walking with Warrior program is even an expansion of services. With the Navigators we have now, I mean, we're already trying to network and partner with as many agencies as possible. So I just see even a further expansion and entrenchment into a lot of our behavioral health providers, more partnerships with some of the VFWs and the DAVs, the different auxiliaries in the community. So I just see us as growing and expanding even more, making even more connections in the community to help even more Michigan's veterans out.
I think Walking with Warriors program is important because we're just a great service. You know, when I got out of the military, I didn't even know about the VA hospital. I didn't know about anything that was out there that I could take advantage of. You know, connecting people to those services is paramount, and we're getting people benefits that never had benefits before. You know, we're finding those veterans, and that's kind of part of being able to get out. I can go out and see some people. I'll go to a resource event and I'll meet up with the people, with veterans, and then I'm able to get them the services that they need.
Walking with Warriors is an extremely important program because we do assist veterans. I am a Army veteran. I am also a spouse of an Army veteran. He served for 23 years. And I am also a proud Army mom. And I would hope and pray that, especially with my son, that there was a program like this when he gets out of the military that can assist him with the resources and assist him getting any help that he may need.
Well, one thing for sure with the military culture is we're not very good at reaching out for help. When I look back at my own history, it was a Vietnam veteran that recognized something in me, and I was able to speak to him in a way that I wasn't able to speak to other people. So if there's a veteran that's struggling, that's having a hard time, it isn't a sign of weakness to talk to someone else. Sometimes just simply talking to another veteran can help with that. There's things that we experience as veterans that the rest of the people in the world just don't fully understand. So a veteran navigator, or even this program here at Heroes Haven, gives people an opportunity to open up in a way that they might not be able to with other people.
You know, number one, I think as an Army chaplain, with my background taking care of families and serving families, that looking at the Navigator program from that perspective of that caring and watching, the Navigator is really a hands-on, frontline triage person. You know, it really engages that veteran and their family where they're at when they're hurting, And in all the homes I've been in as an Army chaplain has really benefited. I've seen the benefit of having that one-on-one engagement and really believe that that face-to-face connection, that personal connection for our navigators and myself is going to lead to the greatest success in our program. And I can say that as well, that the state of Michigan has been a huge supporter as far as my entire program with this, with a veteran perspective, with a brand new position that they began 4 years ago. And so they've been supportive. I have a supportive team that backs me up, and as well as having 26 people on this team now that are really working together. And we have our challenges like anything else, but I think one of the great successes we've had this year, despite COVID, is that our navigators have gotten really creative and really met the needs of our veterans despite the circumstances.